Hello, my name is Noah Foreman. I am a second year DPT student at the University of Colorado Anschutz Medical Campus. The following are my responses to the 6 provided prompts for my application for my final clinical rotation at Medical Services at CU Boulder. While I feel as though I possess a number of characteristics that could contribute to success as a physical therapist, such as empathy or patience or a good bedside manner, I would say that my greatest workplace strength is my ability to compartmentalize in a PT setting and focus in on just the patient in front of me. In a PT setting, as we all know, there are plenty of distractions that could contribute to drawing my attention away from the patient interaction that I am currently having. Whether it be the looming documentation that needs to get done, concurrent treatment sessions within the same PT gym, or a prior patient interaction that happened earlier in the day. There are plenty of things that could draw my attention away from just the patient in front of me. However, I feel as though I have a strength in a PT setting to be able to focus in on just the patient in front of me. In this way, I am able to block out both the literal and figurative noise that may be occurring in the greater PT clinic. As a result, I feel as though I am able to create an environment where the patient in front of me feels both seen and heard, and I am able to adapt and create individualized programming and treatment sessions for my patients and accurately represent all of the things that occurred in a treatment session in my documentation. The scenario provided in which a patient begins crying upon being brought back to a treatment table, in my mind, emphasizes the need for any physical therapist to have at least a plan B when going into any patient interaction. The way that I would handle this scenario involves several steps. The first would be to create an environment that is as safe and as comfortable as possible for the patient. An example of this may be to bring the patient out of the treatment gym and into an area that is calmer and quieter to prevent any added distress from the surrounding noise. The next step would be to avoid utilizing specific or probing questions when trying to gather information from the patient. Instead, I would err towards open-ended questions such as, "What's going on?" or "What are you feeling?" to give the patient power and allow them to determine how much or how little information they provide to me. The next step would be to identify myself as a resource for this patient. I would ensure to them that the clinic is a safe space and that I am available to not only listen to their distress or concerns, but also to provide the necessary resources and referrals available in case they need it. The final step that I would utilize in treatment of this session would be to suspend my own judgments or requirements or thoughts about what this treatment session needed. If I needed to adapt my treatment session so that it was more therapeutic or communicative in nature, I would make those adjustments in order to provide the best possible care for this patient at that time. In the scenario provided, in which a patient shows up late to a treatment session due to factors that are out of their control, I would imagine that the patient would be feeling rather frustrated or distressed. I would handle this scenario in several steps. The first would be to lend a listening ear to the patient and allow them to voice any concerns, any frustrations, or any complaints that they may have. My second course of action would be to offer both my condolences and an apology on behalf of the clinic and organization that I am associating myself with. The third course of action would be to further strengthen my therapeutic alliance with my patient. In order to do this, I would acknowledge that while we may not have as much time for this treatment session as we may have anticipated, that's okay. I would offer potential intervention strategies to the patient and give them choice in what they wanted their treatment session to look like. By doing this, I would emphasize the teamwork nature of physical therapy in general and the rehabilitation of patients in physical therapy. This scenario draws to mind a quote by Maya Angelou that we have talked about on numerous occasions in my DPT curriculum, which states, "People will forget what you said, people will forget what you did, but people will never forget how you made them feel." By creating this teamwork nature and giving my patient autonomy and choice in their rehabilitation strategies, I would hope to create a sense of welcoming and comfort in my treatment session and hopefully ease some of the tension that was created in the events leading up to the appointment. One patient that comes to mind is one that I actually encountered in my last job before starting PT school. I was working at a recovery center in Denver that utilized a multidisciplinary approach to care, including massage therapists, chiropractors, athletic trainers, as well as physical therapists, all operating within a recovery center that included hot and cold tubs, infrared saunas, and a variety of other modalities, including electrical stimulation. The clinic was primarily designed for athletes, ranging from the weekend warrior all the way to professional athletes that would come in to use our facility. However, one patient that would come in and use our clinic frequently was a woman who had been diagnosed with a rather aggressive form of Parkinson's disease that significantly limited her mobility. At best, she could walk short distances with a four-wheeled walker, but needed a lot of help in order to get to and from treatment sessions and to utilize the modalities in our clinic. Originally, her presence created quite a bit of frustration and complaints among the technicians and providers in the clinic, but she quickly became my favorite patient, believe it or not. And I would take the extra time to lift her up onto tables for treatment sessions, walk her to and from her chiropractic services, and help get her in and out of our infrared saunas. I spent so much time with her in my previous job that I learned a lot about her, including the fact that she was a physical therapist before she retired and even a graduate from the University of Colorado PT program. Her and my relationship grew so much during my time in my last job that she was actually the first person I told that I got into PT school, and she cried when I left my clinic in order to pursue this career. She is a constant reminder to me that sometimes in any clinic setting, the patients that require the most amount of time and care are oftentimes the most rewarding in practice. If I noticed in clinic that my CI were utilizing interventions that I knew may not be backed by the most current evidence or research, I would approach this situation from a lens of curiosity first and foremost. I find that asking questions is an unassuming way to allow my CI to provide explanation into their chosen interventions, and also allows me to provide some input in a way that is non-confrontational. It allows me to ask follow-up questions like, would it be okay if I tried X, Y, or Z intervention for the next patient? And in that way, fosters some meaningful conversation about what are the most effective treatment plans for particular patient populations. I did have some experience with this in my previous clinical rotation, in which I had two separate CIs who worked in separate hospital systems. They treated patients post-TKA rather distinctly, one of which would facilitate their patients putting their feet on the ground and sitting in an upright position in order to force the heart and lungs to work in pumping blood against gravity. The other would not allow their patients to put their feet on the ground and instead facilitated elevation of the legs to prevent pooling of blood or edema in the lower extremity. I noticed that these were very distinct ways of treating very similar patient populations and facilitated some meaningful conversation with both of my CIs by asking questions about their experience and their rationale behind their chosen interventions. In this way, we had meaningful conversations about what are the most effective treatment plans for that patient population, and it helped better my understanding of how to approach treatment of these patients moving forward. Like any physical therapist or medical provider, one thing that brings me joy in clinic is watching my patients both mentally and physically progress through their rehabilitation. That being said, something that is equally, if not more, meaningful to me at this stage in my education is reflecting on my own progression and development as a clinician within a PT setting. I feel as though there are two things that often accompany a DPT student as they make their way through their education. One of those being the sense of imposter syndrome, and a second thing being guilt for not knowing the answer to every question that is asked, either from peers, providers, or patients. One thing that brings me immense joy in clinic day to day is being able to combat those two fears as I improve on my ability to treat patients. Being able to more independently utilize what I am learning in my didactic content, as well as identifying myself as a resource to my patients for both information and rehabilitation strategies, is something that progresses me forward and drives me day to day to provide the best possible patient care in clinic. Thank you so much for the opportunity to provide my responses to those 6 prompts. I am looking forward to meeting you all and further discussing this opportunity in the near future.